Hi there, this is Dr. Moyer, and I will be talking about program ethics with you. You may have noticed that I post PowerPoints that are not narrated, and then I often narrate them so that you have them if you need to go back to them, or you can print them out and take notes on them while listening to me. It's something that students have asked for in the past, and I aim to please, so that's what I do. Another thing I want to clear up before we get too much further is that your program evaluation project is to be an actual evaluation of anything. I mean, literally anything can be evaluated. Maybe you want to evaluate, does the mail come at the same time every day? I mean, you can do that. You have to actually have some data, and we'll go over different data collection methods a little bit later. And you actually have to write up the results and the findings and do a presentation. But it doesn't have to be a real program. It doesn't have to be something super serious. I encourage you to have fun with it. It's really just to get the practice. It's very similar to research methods, only we do a couple of different things because it is a program evaluation. But again, it's to get the practice. So let me know if you have questions about that. You are welcome to ask me anything, as you may know. So moving on, we're talking about program ethics this week, and I did post an assignment regarding the brown-eyed, blue-eyed project that Jane Elliott did in the 60s, and it's on PBS. You can watch it for free, and then I have some questions for you to answer. And this isn't an assignment for points. This is part of your discussion at points, participation points, and it's really just to get some practice and to really think about this kind of evaluation that Jane Elliott did, which was really required thinking about ethics. So I hope that you enjoy that, and I think that you'll be interested in it if you haven't seen it before. Okay, so when we work with people, when you do a program evaluation, you may not always be working directly with people. But if you are, there are some issues that you have to consider. 3 of them are up here on the PowerPoint now. Assignment to program groups, informed consent, and confidentiality. So when you're thinking about program groups, what this would mean is if you have a treatment group or a program group, we'll say, that the program participants are actually experiencing the program, and the goal of the program, let's say, is to improve reading skills. And then you have a control group that isn't in that program. Is there going to be any harm coming to the people that are not in the program group? How do you determine who is assigned? Do you offer it to the control group if you find that it is effective? And then even the people participating in the program, you have to make sure it is ethical and that no harm can come to them just by participating. So let's say the fake program we're talking about now is a reading program, and you're requiring people to read really tiny print, let's say like an 8-point font, for 4 hours a day. Eye strain could happen, particularly depending on someone's age. So that would be an example of some harm. And so you, as the evaluator, need to look out for this and think about it. And then if you are doing an evaluation and you're affiliated with a hospital or a university, you oftentimes have to, and what I mean by affiliated is getting funding or getting any type of resources from them and planning on presenting your findings. Then you have to get permission from the Institutional Review Board, which would also be looking out for their participants' well-being, we'll say. The informed consent, if you've participated before in any type of study, you know that you have to sign what is called an informed consent. There is some debate about how much needs to be on the informed consent? Do you explain everything? Or do you just give enough information that they know what to expect? And most researchers and program evaluators would say just enough information so they understand the purpose, what they can expect if they participate, and any risks or benefits that are part of it. And then after the the evaluation is complete, you can then give them more information about it. So, not saying you want to go around tricking subjects all the time, but sometimes it's necessary that the participants don't know what's really going on so that you can do a better job evaluating whether or not the program works. Because if they do know, it might affect how they answer or respond or act. And so you have to make a decision about that. If it's not going to harm the findings in any way, then it makes no difference, and you do want to be like an open book and as transparent as possible. But if it's something that you need for them not to know, like maybe you're evaluating racism, and you know that if you tell your participants this, they're going to be on guard and really thinking about their answers. Where if you told them it was about human behavior and decision making, maybe they wouldn't focus so much on what kind of acts might be construed as racist. Does that make sense? And then after, you could tell them what it was really about. And again, it's not to trick anyone, it's to get the most accurate findings possible. Confidentiality. There's usually two issues when we talk about confidentiality. Either it's going to be confidential and you know the identity of the participants, but you use a coding system with the data when you're doing analysis, and when you write it up, you use pseudonames or numbers. You never use a participant's actual name. Or is it going to be completely anonymous, where you don't even collect any identifying information, so you can't link findings to an actual person? Those are two different things, and you need to think about which one applies to your evaluation. Some other ethical concerns, you need to think about stakeholders. So in my last PowerPoint, in steps 1 through 4, we talked about different levels of stakeholders, and there are always stakeholders, no matter what kind of evaluation you're doing. I mean, even if you're evaluating is the mail on time, stakeholders could be your neighbors. They want to know too. It also could be the postal service. They want to know if it's being delivered efficiently. You just have to think about who, has a stake in whatever it is you're looking at. So, how do you make sure that you're meeting all of the stakeholders' needs, particularly when it comes to ethical concerns? These are generally some statements that do apply, particularly when you're looking at programs. And since that is the point of the class, that's what we're going to use as the example. So program managers are usually concerned with efficiency. How quickly can things get done? Is it cost efficient, etc. Staff members want assistance with service delivery. So they want to make sure that they have the resources they need, the staffing they need to do the most effective job. Clients want effective and appropriate services. Of course, they want results. They want it to work. And then community members are often concerned with cost and effectiveness because everyone wants the program to work. But if the program is super expensive, communities are not going to be able to adopt it. So how do you make sure you're meeting everyone's needs? You have to stop and really think about the different types of needs that they have. And let me go back to that slide. And whether or not you are going about meeting these needs in an ethical manner. So I think it's pretty straightforward, but because program managers are concerned with efficiency, we'll say you have to make sure that you don't taint the data by saying to maybe the staff, that, this has to be an affordable program or they're going to cancel it. So you want to emphasize how affordable it is so that you can raise the cost of effective or efficiency findings. It's unethical to do that. You cannot taint the data. If you do taint the data, the findings that you have are not going to be able to be replicated. And if your findings are not able to be replicated, then your program is unlikely to be adopted. So what happens is when you have a program that you've followed the scientific method in conducting the evaluation, and you have been very concerned about the ethical issues, and you follow everything to a T, and then you publish and present that program, other people will want to adopt it, and you don't want to reinvent the wheel, and they're going to adopt the program and do their own evaluation. And if they don't have similar findings, they're going to wonder why. If a program can't be replicated, they're going to really examine what happened. And if it comes out that a program evaluator influenced the data in any way, that's a serious ethical violation, and one which would be very difficult to get off your record and be forgiven for. Okay. So some negative sides of evaluations when we're considering ethics. Can someone be hurt by inaccurate findings? Obviously, yes. If you find that your reading skills program is super effective, but it really isn't, so that would be a type 1, it's what we call a type 1 statistical error. So then you go to incorporate it and you're counting on this, and the community and schools are investing a lot of money and parents, but it's not even working. That's a huge problem. Or you could conduct or commit a type 2 error, which means that you concluded, or your findings, you concluded that the program is not effective when it really is. And that's just as bad, because you want to know that the program's effective if it is. And so there are different things that we do to try to make sure that we don't have these errors. And some of them include things you probably have already been introduced to in research methods. So the reliability and the validity of the instruments that you use. So whatever methodology you use to collect data, make sure that it's reliable, that you can show that it's reliable, and that it's valid. Reliable just means that you're going to get the same kind of results over and over again if you use that same method or same survey, same instrument. Valid means that you're actually measuring what you intend to measure. And so there are different ways that is accomplished. It does talk about it in your textbook. And I'm going to let you use research methods to help inform that as well. Sample size is another big deal. And so if you don't have a big enough sample that you can even find that the program is effective because you don't have statistical power, then you're going to commit a type 1 error. Or a type 2. You could actually commit either one. You want to have a big enough sample that you can find whether or not there are accurate findings attributed to the program. You also have to think about unplanned effects, intended or unintended. An unintended effect of a reading skills program could be that because the program requires an adult to read to the child for 2 hours every week, that it actually improves communication and the relationship between the child and the adult that does the reading. That wasn't something you intended to happen, but it did, because they're spending time together and they're reading together. And so that'll be a positive unplanned effect. But an unintended effect could be like the font size I was talking about earlier. If you're making somebody read 4 hours worth of 8-point font, and it causes eye strain, that was not intended, but it did happen. And that would be a negative unintended effect. So these are things you also have to consider. If they're positive, that's great. Your book talks about how Head Start, when it first began, there were lots of unintended positive consequences that now are actually used to promote the program, because now we know about them. But in the beginning, they weren't measured or evaluated because that wasn't part of the goals. The unintended negative effects, you of course want to minimize or get rid of altogether. And then finally, implicit values held by evaluators. Probably when we're talking about ethics, this is the most important point of all. Before you go into an evaluation, you have personal values and beliefs that you carry around with you in your mind that you may or may not even be aware of. And you may have assumptions about the clientele. You may have assumptions about the area where the program is located that affect how you think about the clientele. You cannot conduct an objective evaluation without identifying what these assumptions and values and beliefs are and making every effort to control for them. So that means, let's say that I have ideas or assumptions about people that live in off the grid in Alaska. You know how those shows are popular right now? But I have to evaluate a program that gets resources to them. If I don't deal with those assumptions, it could affect or taint the evaluation. Maybe one of my assumptions is that these people are uneducated. So, okay, I'm not going to evaluate anything that I think an educated person would have, like skills, knowledge, resources, etc. I just completely ignore that part. What if I'm wrong? What if it turns out that 80% of the people that live off the grid are highly intelligent? But because of my own assumptions, the way that I constructed the evaluation was affected, and as a result, it influenced the findings in a positive or negative way. It doesn't go either way. The point is, I have to address those assumptions with myself. So, thinking about, what assumptions do I have about people living off the grid? Write them down. Talk about them with other people. Get them out there. And then do your research. Find out what the truth is. Find out the statistics. Do a pilot study and get some basic demographic data. Find somebody that works with this population or has even lived off the grid themselves that can tell you, about that population. You have to dispel any stereotypes, and that can be incredibly difficult. And if that's not something that you think you can do in a truly objective manner, you shouldn't even take on the evaluation. Any feminist researcher will tell you that there is no true objective study or evaluation, that we go into our evaluation. Part of us does. And so the way that feminist researchers handle this is they address and talk about their assumptions in the study they're publishing. They have a whole section on this is where I'm coming from, and this is how I conducted this study. That way the audience is well aware, trying to be as transparent as possible. And that can be a tactic that you could use as well. The idea is to be ethical, and the idea is to be objective. And so that's what you want to accomplish. The IRB, you've probably been introduced to if you have taken research methods. The Institutional Review Board, it's just a group of people from either a hospital or a university or a college that sit on a committee and review proposals to determine whether or not they are ethical. And that is the main concern. So if you're ever asked that in a comp, it is ethics and it's the participant that the IRB is concerned with. So that may be something that you have to do. It may not. Regardless, what I always tell people is assume that you have to use an IRB and get their approval, and go about structuring your proposal that way. And then even if you don't, at least you're following the general rules, the guidelines, you're following your common sense and concern for the participant, and you're trying to be as ethical as possible. That'll never get you in trouble. So that concludes the lecture on ethics. I hope it was helpful. Many students make the mistake of just going into thinking about ethics as, oh, of course I'm concerned about the treatment. But there's hopefully you know now after hearing this and reading your book that there is more to it, and it's actually kind of complex. So don't oversimplify ethics. Okay? That's all.